If you answer yes to these 7 questions, then your headache is most likely a tension type headache. 1. Is your headache mild to moderate and does not interfere with your activities? 2. Is your headache on both sides of your head like a headband? 3. You don't feel nausea when you have this headache. 4. Sounds and lights do not make your headache worse. 5. Exercise and physical activity does not make this headache worse. 6. The pain lasts a few hours and improves with simple analgesics. And 7. Pain is not pulsating like a heartbeat. Today, I will explain how to treat and prevent tension-type headaches. This video is the 4th in a series about headaches. My previous videos were about migraine, cluster headaches, and trigeminal neuralgia. Stay tuned to the end, and I'll tell you about my next video in this series. So let's talk about tension-type headaches today. Before I continue, let me remind you that this video is not intended to replace medical advice. It is for educational purposes only. Please talk to your doctor about the diagnosis and treatment plan for you. In case of emergency, please go to the nearest emergency department or call an ambulance. In the first video of this series, I explain what a migraine is. It is essential to see a doctor who can diagnose you if you have your headache. It's like a tension-type headache or a migraine, because the treatment is quite different. For example, migraine can worsen with physical activity, but exercise generally improves tension-type headaches. Tension-type headaches are primary headaches, which means no illness or lesions in the head or the brain. Tension-type headaches is caused by tension, both in the mind and the body. It is caused by sensitization of the pain system. Watch my other video about central sensitization. When we are under stress, we may become anxious, worried, fearful, sad, or depressed, which puts tensions on our minds. When we have a terrible posture and hold awkward positions, our muscles are tense and develop trigger points, which is tension in our body. That is why tension-type headaches get worse when we are under pressure, under a lot of stress in our lives. And the main treatment involves learning techniques to reduce the effects of stress on our bodies. We can't avoid stressful situations in life, but we can control how they affect us. Tension-type headache is the most common headache, affecting about 80% of people at least once in their lifetime. I am privileged to be among the 20% of humans who never had a headache in my life. The main treatments for tension-type headaches include mind-body relaxation therapies, such as cognitive behavior therapy, or CBT, biofeedback, mindfulness, meditation, and relaxation techniques. We also recommend movement as a form to relax the mind and body. Any type of exercise works. What is essential is that you enjoy and adhere to a routine. Massage, acupuncture, dry needling are also helpful to relax the muscles. You can use over-the-counter medication like analgesics, acetaminophen, NSAIDs, and muscle relaxants if necessary. Talk to your pharmacist about these options. Your doctor may prescribe antidepressants for a few months to help you sleep better. I usually start with amitriptyline or trazodone. Opioids should not be used due to the risk of dependence, addiction, and medication overuse headaches, or MOH. Preventive therapy is not necessary. These headaches are painful, but they are not harmful. Most cases improve without treatment, and they do not affect everyday work or function. Patients may use amitriptyline, an antidepressant for the prevention of tension-type headaches. I have another video in that I talk about amitriptyline. There might be complications when the person uses too many medications to treat tension-type headaches. Too many over-the-counter medications can lead to mega doses of caffeine containing analgesics. Could be dependence and addiction to opioids, stomach or bowel bleeding from taking too many NSAIDs, and medication overuse headaches. Well, I made this video series in collaboration with Migraine Canada. If you want to learn more about headaches and migraines, visit their website. They have a lot of resources, events, and education materials for you to learn more about migraines. You may use a headache diary to track your symptoms, and Migraine Canada has a version that you can download and also an app version. If you like this video, give your thumbs up here and don't forget to subscribe to this channel and turn on the notifications so you can be alerted when I post my next video. In the next video of this series, I will talk about cervicogenic headaches. Thank you for watching today. Goodbye.